Hi, my name is Natalie, and our 2.5-year-old daughter, Christina, has CCHS, which is Congenital Central Hypoventilation Syndrome. She needs ventilation support 24 hours a day. Half of the day, she uses a diaphragmatic breathing pacemaker system. So what that is, it's a mechanical ventilation that is actually internally placed. So she had a surgery and has electrodes placed on either side of her abdomen. They're pretty small, about the size of a quarter. It's just right underneath the skin. You can kind of feel it on the outside. And so from those internal components, there's an electrode that goes up and it stimulates her phrenic nerve. And so what that does, it makes her diaphragm expand and contract, therefore making her lungs inversely expand and contract until she breathes. So that's the internal components of the system. The external components are these antennas right here. So inside on her abdomen is the circle, I guess, the receiver. And so on the outside, you put the antenna directly on top of the receiver, and we tape on the antennas on either side of her abdomen. We just use this gentle tape here, this cover roll stretch. It comes in a thick roll, so we cut it with scissors into little sizes like this, and so we tape it in an X on Christina's stomach on either side. And so she has each antenna on either side of her stomach taped on. And so then the antenna, it has this metal piece right here that actually plugs into this transmitter box. So she has the Mark IV transmitter system by Avery Biomedical. And so to plug it in, you just have this little metal piece on the antenna, and it plugs directly into the unit right here. Just push it straight in. So you would push in both sides of the antennas into the unit. And so right here you can see the dials, and really all that you do is you just move these metal pieces and you turn it on. You can see the red light moving, which indicates that it's actually giving the electrical impulse at that point. You can't feel anything on the antenna, but what it does, it sends this electrical signal, turns into a radio signal that talks to the internal components on Christina's stomach. So there's no wires or anything coming out of her skin. Everything is just taped on. It has a radio signal that transmits to the internal components. So really, I mean, it's as easy as that. You just turn it on, and then to turn it off, you just push the dials back. Everything on here is taped. We have everything set. We don't really adjust any parameters here at home. But so this is the unit right here, and because Christina is only 2.5, it's a lot easier for us to keep this on her because, I mean, this is attached to her stomach. This is how long she has right here. It has to be on her person at all times. We just put it into a little backpack. So we have it like this. We kind of put the cords on the side. We zip it up. And we can also, we kind of put the cords inside here so you don't see cords hanging out underneath her shirt or anything like that. So then she just wears this little backpack around. We found it a lot easier to have backpacks that have little safety harness straps on the front. So that way when she's wearing it, the backpack stays on her pretty much at all times. So every morning, we tape her system on and we take her off the ventilator. We detach the circuit from her trach, and then we just flip the on switch, turn the system on. And so her trach is exposed. So what we do is we put a little double barrel HME right here on her trach. And so it's, pretty inconspicuous. It just sits right here. And then she just paces all day. So with Christina, she paces during all awake hours. So nighttime she's on the ventilator, she wakes up, we put her on the pacers. Right now she's currently napping, so we leave the antennas taped onto her abdomen. We just turn off the unit, reattach the ventilator circuit, have her on the vent while she's taking a nap. We just kind of unplug these antennas from the unit and just let them dangle on her bed. So then when she wakes up in a couple of hours, we'll just plug them back into the unit, put her backpack on, turn the pacers on after the ventilator is off, and then she gets to run around and be mobile. So this is the Mark IV transmitter system right here. And we'll show you how she runs around when she wakes up.